CEN questions and answers YouTube. Question 1. A patient is placed in 4-point restraints for violent behavior. The nurse's ongoing responsibility includes documenting the behavior requiring restraint, ensuring a physician's order is obtained, providing regular monitoring and release of restraints. All of the above. Question 2. A patient presents with right upper quadrant pain radiating to the shoulder, fever, and jaundice. The nurse suspects acute pancreatitis, acute cholecystitis, bowel obstruction, perforated peptic ulcer. Question 3. A patient presents with altered mental status, meiosis, bradycardia, and copious secretions. The nurse suspects organophosphate poisoning. The treatment is naloxone, flumazenol, atropine, and pralidoxine, activated charcoal. Question 4. A patient presents with an opioid overdose with respiratory depression. The nurse should administer flumazenol, naloxone, activated charcoal, atropine. Question 5. An adult patient with acute asthma exacerbation is not improving after 3 rounds of nebulized albuterol and ipratropium. The nurse anticipates oral corticosteroids, intravenous magnesium sulfate, discharge home, chest physiotherapy. Question 6. A newborn with meconium-stained amniotic fluid is delivered. The nurse should suction the mouth and nose immediately, dry and stimulate the infant, perform a brief assessment and begin ventilation if needed, intubate and suction the trachea. Question 7. After a fall, a patient on warfarin is found to have a subdural hematoma on CT. The nurse anticipates administering clopidogrel, vitamin K, fresh frozen plasma, both B and C. Question 8. A patient presents with chest pain, fever, and a friction rub on auscultation. The nurse suspects myocardial infarction, pericarditis, unstable angina, aortic stenosis. Question 9. A 64-year-old male presents with crushing substernal chest pain radiating to his jaw and left arm. He is diaphoretic and nauseated. His ECG shows ST segment elevation in leads V1, V4. The nurse anticipates an order for aspirin 324 mg chewable, morphine sulfate 4 mg for push. Question 10. A post-cardiac arrest patient remains comatose. The nurse prepares for emergent coronary angiography, therapeutic hypothermia, targeted temperature management, immediate extubation, administration of TPA. Question 11. A patient with COPD and a history of carbon dioxide retention is receiving oxygen via nasal cannula at 4 liters per minute. The nurse notices the patient is becoming lethargic. The appropriate action is to increase the oxygen to 6 liters per minute, decrease the oxygen to 2 liters per minute, prepare for intubation, administer naloxone. Question 12. A previously healthy patient presents with acute onset of shortness of breath, hypoxia, and normal chest X-ray. The nurse's primary differential diagnosis is pulmonary embolism, asthma, pneumothorax, myocardial infarction. Question 13. A patient presents with urticaria, angioedema, and difficulty breathing after receiving 4 contrast dye. The nurse's priority is to administer diphenhydramine, administer epinephrine, start in 4, call a code. Question 14. A patient presents with acute onset of tearing chest pain radiating to the back, along with a blood pressure difference of 30 millimeters of mercury between arms. The nurse suspects acute myocardial infarction, aortic dissection, pulmonary embolism, pericarditis. Question 15. A family member of a patient in cardiac arrest insists that everything be done to save the patient, despite the patient's living while declining aggressive measures. The nurse should follow the family's wishes, continue CPR until the physician clarifies the advanced directive, stop CPR immediately and contact risk management, ask the patient what they want. Question 16. A patient with a history of seizure disorder is actively seizing for 5 minutes. The nurse's priority is to place a tongue blade in the mouth, restrain the patient, administer 4 lorazepam. Start in 4. Question 17. A patient presents with descending paralysis and areflexia following a recent viral illness. The nurse suspects Guillain-Barré syndrome, multiple sclerosis, myasthenia gravis, stroke. Question 18. A patient with 3rd degree complete heart block is bradycardic and hypotensive. The nurse should anticipate atropine 0.5 milligrams for push, transcutaneous pacing, adenosine 6 milligrams rapid for push, amiodarone 150 milligrams for. Question 19. A patient with chest pain has a 12-lead ECG showing a new onset left bundle branch block. The emergency nurse should prepare the patient for a stress test, immediate transfer to a medical surgical floor, coronary angiography, observation for 6 hours. Question 20. A 4-year-old presents with a 2-day history of a rash on the neck, chest, and back. The lesions on the neck are crusted, and the chest lesions are tiny vesicles on a pink base. The child has a temperature of 39.1 degrees Celsius. The father asks when the child can return to school. The nurse advises 24 hours after the last fever above 38.3 degrees Celsius. Tomorrow, once all the lesions are crusted. In 2 weeks when all the lesions are crusted.